The risk of breast cancer increases with age. It can happen to nearly any woman and also men and can be unpredictable. So we've invited back our good friend and colleague, Dr. Freda Lewis-Hall, the Chief Medical Officer of Pfizer, to talk about some of the factors that may lead to breast cancer. Dr. Freda, important topic. Thanks so much for being here.
Thanks for having me. So each year, about 250,000 women and nearly 2,500 men are affected by breast cancer in the United States. Now, that means gender is a risk factor. You mentioned that increasing age is a risk factor, and there are other risk factors like race and ethnicity, lifestyle, and family history. But not all risk factors are created equally. For example, while white women are more likely to get breast cancer, when African American women get breast cancer, they are more likely to die from it. In fact, in the United States, deaths from breast cancer in African American women are 40% higher. This may be due to the fact that sometimes it's diagnosed at a later stage when the treatment options are more limited.
Now let's talk about other groups that may be at an increased risk, those with a family history. If a person has a mother, sister, or daughter who has been diagnosed, their risk can double. It can triple if two close relatives have breast cancer. Certain genes can also increase a person's chances of developing breast and other types of cancer. So, Dr. Freda, let's walk through the most common cause of hereditary breast cancer involving the BRCA1 and BRCA2 genes.
Every human has a BRCA1 and a BRCA2 gene. These genes do not cause breast cancer, which many people believe. In fact, normally these genes work to repair DNA breaks that may lead to cancer and uncontrolled growth of tumors. However, in some people, these genes become altered or broken and then are not able to function fully. These are called gene mutations. So when BRCA1 and BRCA2 genes are mutated, they may no longer be able to fix those DNA breaks and help prevent breast cancer.
So people with a BRCA gene mutation, they may be more likely to develop breast cancer and more likely to develop cancer at a younger age. And to those who receive a breast cancer diagnosis, talk to your medical team about being genetically tested because it may help determine a treatment option for you.
And for those that have not been diagnosed with cancer, it's important to talk about the BRCA1 and BRCA2 genes, especially if you think that someone in your family has that gene mutation. So talk to your healthcare professional about whether or not you should get genetic testing, because knowing your risks is the first step to being able to complete a plan for prevention, for detection, and early diagnosis, which can increase the best chances for a good outcome.
So very true.
And this is also complex. The BRCA1 and the gene testing. So many people want more information. We have that on gethealthystayhealthy.com. It's a good place to start for that information.
And here are a few other things everyone out there needs to know. The American Cancer Society recommends beginning screening for most women at age 45, but everyone's individual risk is different. So talk to your doctor about what is best for you. And Dr. Freda, I just want to know, what other resources do you recommend for those who may be concerned about breast cancer?
Well, there are lots of resources for sure that are really good and very helpful. I mentioned gethealthystayhealthy.com earlier. I also want to mention another resource that we have from my company, Pfizer. It's a website called This Is Living with Cancer and an app called Living With. The site and app are meant to help people who have been diagnosed with cancer manage everything from scheduling doctor's visits to planning daily tasks to connecting with family and friends for support. So check it out.
And Dr. Freda, I want to thank you so much for talking about this important topic with us today. We'll see you soon. More to come.